Welcome to our video about diabetes mental symptoms. You may be wondering what mental symptoms of diabetes are common in people with the disease. These may include mood changes, anxiety, and diabulimia. Read on to learn more. Depression can affect both physical and mental health. The following are some common diabetes mental symptoms. If you are experiencing any of these symptoms, seek treatment immediately. Depression is very serious and can lead to many health complications. Listed below are a few tips for managing these symptoms. Anxiety. If a patient suffers from anxiety as a mental symptom of diabetes, a joint treatment plan can help them cope with this symptom. To determine whether a patient's elevated anxiety levels are related to diabetes, a thorough medical history and physical examination are essential. Other tests, such as a complete blood count and metabolic panel, should be ordered if anxiety symptoms persist. A thyroid-stimulating hormone test should also be performed. In addition, a urinalysis and urine drug screen is necessary. An electrocardiogram should also be ordered if a patient's anxiety level is abnormally high. The following clinical tips can be used to assess and manage anxiety symptoms in patients with diabetes. Anxiety as a mental symptom can result from many different factors. It can be caused by stress or fear of certain health complications. Many people with diabetes are fearful of losing control of their health. It can be difficult to follow prescribed dietary changes, monitor blood sugar levels, and adhere to lifestyle modifications. These factors can also contribute to an individual's anxiety, which can affect their quality of life and ability to manage diabetes. While diabetes is a chronic condition, it may lead to anxiety or depression. Higher blood sugar levels can lead to general feelings of depression. These emotions may also exacerbate anxiety. To help combat these symptoms, young people with diabetes should be evaluated for signs of anxiety and depression. Getting support early is crucial. One Yale study found that diabetes is associated with an increased risk of developing eating disorders. Anxiety around food and weight can result in an eating disorder. Depression. Managing diabetes can be difficult, especially if you suffer from depression. Although many treatments for depression are available, there are some differences in the way they affect people with diabetes. People with type 1 diabetes cannot manufacture insulin on their own, which means their pancreas is unable to produce insulin. This condition can be difficult to manage and can lead to depressive symptoms, which can make managing diabetes difficult and can lead to physical complications and decreased lifespan. A doctor will likely perform a physical exam and ask about your symptoms. He or she may also order blood tests to rule out any underlying illnesses. If depression is a symptom, your doctor may refer you to a mental health provider, such as a psychiatrist, psychologist, social worker, or counselor. A psychiatrist or psychologist can provide treatment to help patients manage their diabetes and their mental symptoms. However, this may not be the best treatment for everyone. Although there is no definitive relationship between depression and diabetes, many studies have reported that depressive symptoms increase with the duration of diabetes. The high prevalence of depression in people with diabetes has led to increased healthcare costs, but treatment for depression appears to be more cost-effective. Depression treatment reduces the number of days spent in the hospital and saves money on both outpatient and primary care visits. A recent study found that women with diabetes were more likely to undergo mental health treatment than their counterparts. Diabulimia. The best treatment for diabulimia is to find an effective way to overcome it. Behavioral therapy can help you learn new ways to cope with the disorder. Cognitive behavioral therapy focuses on identifying cognitive distortions and developing personal coping strategies to deal with the disorder. It is also very effective at addressing co-occurring mental issues such as depression, anxiety, or self-esteem. Depending on the severity of the condition, your healthcare provider may recommend hospitalization as the first step in treatment. In the hospital, healthcare providers can watch your blood sugar levels and administer insulin accordingly. Additionally, they may order tests to diagnose other complications related to diabetes. Treatment for diabulimia may be expensive, ranging from free support groups to intensive outpatient programs that cost thousands of dollars. While the physical symptoms of diabulimia are more obvious, the psychological effects are equally significant. Diabulimia sufferers will often be self-conscious, blaming themselves for their weight and using insulin to manage it. The effects of diabulimia are long-term and short-term. Symptoms can range from slow wound healing to susceptibility to staph infections. In severe cases, organ damage and electrolyte imbalances can develop, leading to serious complications including retinopathy. The best treatment for diabulimia is a multidisciplinary approach. Individual therapy, nutrition, and medication may be used to treat the condition. The patient may also need psychiatric evaluation. Diabulimia recovery programs offer daily support groups and medical supervision. Diabulimia is a life-threatening eating disorder and must be treated appropriately. There is a wide range of treatment options available, and an integrated mental health team will work with a physician and a nutritionist to find the best treatment. Mood changes. The emotional toll of poorly controlled blood sugar can lead to mood changes. In addition to the physical difficulties associated with the disease, people suffering from diabetes can be bothered by daily regimens and changes in their lifestyles. Moreover, the stress of managing diabetes and the fear of complications can lead to mood changes. These feelings can lead to poor mental health, poor motivation, and even depression. Here are some tips to help you deal with your diabetes-related emotions. Blood sugar levels are closely related to mood. During periods of low blood sugar, you may feel emotional and tearful. However, when your blood sugar levels are high, you may feel happy. In this case, it's best to monitor your glucose levels and consult with your doctor. If you notice mood changes, it's time to adjust your diabetes treatment plan. If necessary, you can use a fast-acting carbohydrate in an emergency. Mood changes as a result of a diabetes diagnosis are often caused by increased anxiety or fear. People with diabetes are more likely to experience depression because of the additional responsibilities and lifestyle changes that accompany the condition. Oftentimes, they are unable to cope with the additional stress caused by diabetes and the looming fear and uncertainty that accompany this condition. In such cases, recognizing the signs and symptoms of depression or anxiety is critical. Stress hormones. People with diabetes need to pay attention to their mental state. Increased levels of stress hormones will cause their blood glucose levels to rise. This can wear down diabetics physically and mentally. This stress can cause a range of other physical symptoms as well, including mental confusion, poor concentration, and fatigue. As such, healthcare providers need to know more about how stress affects the body and identify strategic ways to help patients cope. Several studies have confirmed the connection between physical and emotional stress and diabetes. Chronic emotional stress has been linked to a higher risk of developing type 2 diabetes. High cortisol levels in the blood may block the pancreas insulin-producing cells from functioning properly. Insulin is an important hormone for controlling blood sugar and managing diabetes. However, despite its link to diabetes, doctors cannot make a conclusive connection between stress and the condition. Oftentimes, people with diabetes experience both physical and mental symptoms of diabetes. Stress increases the production of adrenaline and cortisol in the blood, which affects insulin levels and glucose metabolism. Those with diabetes can have higher blood glucose levels than those without diabetes. They may stop monitoring their glucose levels or eat more than usual. Further, stress can cause diabetes symptoms and other mental problems. Although it's not clear whether stress hormones play a role in the development of diabetes, research indicates that a relationship exists between the two. Treatment. Many people don't know that diabetes can cause a variety of mental symptoms. For example, people with diabetes may experience feelings of grief similar to those of someone who has lost a loved one, or they may feel weak and vulnerable as a result of their illness. Diabetes can also make you feel apprehensive, lonely, or stressed. To help deal with these symptoms, talk to your doctor about your condition and get the help you need. While big fluctuations in blood glucose levels are often an indication of physical problems, they can also reflect concern about the diabetes management plan. In addition, patients may be worried about the cost of the disease and its long-term treatment. Additionally, mental illness can interfere with adherence to the treatment plan. Stress is a significant cause of diabetes-related anxiety. This can make patients feel less motivated to keep up with their treatment plan. Fortunately, treatment for diabetes mental symptoms is available, and it's more effective than ever. One recent study found that patients with comorbid diabetes and depression were less likely to be screened for eye complications, blood pressure, cholesterol, or obesity. Additionally, they were less likely to be offered a statin or diabetes education than people without diabetes. Unfortunately, diabetes and mental illness are often not adequately recognized in our healthcare system, which contributes to the poorer health outcomes we see today. So, how can we treat diabetes mental symptoms? Thank you for watching. Please like, comment, and subscribe if this was helpful. Stay healthy and let's beat diabetes.